Evil speech is not harmless, and when it comes out of the mouth of someone entrusted with human life, it is not just disturbing, it is disqualifying. What we are witnessing right now is not political disagreement. It is the normalization of cruelty, the celebration of harm, and the erosion of professional and moral restraint, all wrapped up in the excuse of activism. And families are paying attention and paying the cost. Welcome back to Family Still Matters. I'm Deborah. This channel exists for one reason: to protect families, children, and moral clarity in a culture that increasingly excuses chaos and cruelty. I'm asking you to stay with me through this entire message because what we are about to address affects mothers, pregnant women, families, and public trust in healthcare. This message is for adults who understand that words have weight. It's for parents, mothers, and families who care about who is present during their most vulnerable moments. This message is not for people who excuse evil speech as just venting. It is not for those who think professionalism disappears the moment politics enters the room. No apologies for clarity. What is at stake here is trust. Trust between a patient and a caregiver. Trust between mothers and hospitals. Trust that when someone is at their most vulnerable in labor, injured, or unconscious, that person responsible for their care does not harbor hatred toward them. And this is not theoretical. This is not abstract. This is already happening right now, every day. About a month ago, I published a video entitled Midwives Doula, a prophetic warning on how to keep Black mothers safe during labor and delivery. That message was rooted in real neglect, real harm, and real warning signs. And while that video focused on protecting Black mothers, the truth is this guidance applies to any mother, especially now. In that video, I encourage women not to assume they would automatically be protected simply because they entered a hospital. I urge them to have a doula, an advocate, or a trusted person present, someone whose only role is to watch, listen, and speak up for them. What we're discussing today confirms why that warning was necessary. If you haven't seen that video, you can find it on my channel in the playlist. The message is more relevant now than ever. Over the past weeks, multiple healthcare workers have publicly posted videos encouraging or celebrating harm. One labor and delivery nurse stated she wished severe physical injury on a pregnant woman because of her political position. Another health care worker posted videos encouraging people to drug, poison, incapacitate, or physically harm federal agents while wearing medical scrubs and referencing substances used during medical care. One of those substances was choline, and that matters. Choline, when administered outside of proper anesthesia and medical supervision, paralyzes the muscles responsible for breathing. A person injected with it cannot breathe on their own. They can suffocate and die. This is not exaggeration. This is basic medical reality. These were not private conversations. They were recorded, posted publicly, and in some cases, proudly doubled down on. Free speech protects people from government punishment. It does not guarantee continued employment in a profession built on trust, restraint, and patient safety. Hospitals are not obligated to retain employees whose public speech causes patients to reasonably fear harm. This is not oppression, this is responsibility. Healthcare professionals are entrusted with bodies, lives, pain, fear, and vulnerability. When a nurse publicly expresses joy at the idea of physical injury, sexual trauma, poisoning, paralyzing, or incapacitating, they violate the foundation of their calling. At that point, the question is no longer, did they mean it? The question becomes, can they be trusted? And the answer is no. This conversation forces an uncomfortable but necessary question. If someone is willing to speak this way publicly, casually suggesting harm and incapacitation, it is reasonable to ask whether that same prejudice ever entered their clinical judgment. Just as a lawyer's demonstrates bias I'll say that again. Just as a lawyer's demonstrated bias can call past cases into question, it is fair to ask whether cases involving these individuals should be re-examined. Not because harm has been proven, but because trust has been compromised. When trust is broken, oversight becomes necessary. The Bible is very clear. It says, out of the abundance of the heart, the mouth speaks. What these individuals are speaking tells us exactly what is inside of them. Not compassion, not care, not restraint. What we are hearing is pure, unadulterated hatred. And hatred has no place anywhere, and especially not in healthcare. It has no place around mothers, and it has no place near vulnerable patients. Words are not accidents. They are evidence. Families are not irrational for asking, would I be safe with this person? Pregnant women are not paranoid if wanting an advocate present. When hatred is normalized in healthcare spaces, people will protect themselves accordingly. That is not fear, that is wisdom. Scripture has always taught that words are seeds. What we speak, we plant. What we plant, we reap in reputation, consequences, and judgment. Hatred spoken openly eventually produces loss. Cruelty eventually exposes itself. And evil speech never remains without consequences. Family, parents, and professionals, do not excuse evil speech. Demand integrity from those entrusted with your care and your family's care. Advocate for accountability and protect yourselves, especially in vulnerable settings. We are watching a culture test how far it can go before consequences are enforced. Families must be the line, because family still matters, character still matters, and integrity still matters. And I'll leave you with this reminder. Out of the abundance of the heart, the mouth speaks. Take care of yourself, guard your families, and God willing, I'll see you in the next video. I'm Deborah, and this is Family Still Matters. God bless you.